In the realm of pharmaceuticals, tamoxifen stands as a medication with a multifaceted range of applications. Primarily, it is classified as a selective estrogen receptor modulator, SERM, a class of drugs that interact with estrogen receptors in various tissues throughout the body. This unique characteristic allows tamoxifen to exhibit both agonist and antagonist properties, making it a versatile therapeutic option for various conditions. In this comprehensive guide, we will delve into the typical purposes, benefits, potential side effects, dosage guidelines, and risks associated with tamoxifen, shedding light on its diverse applications and considerations. Typical purposes of tamoxifen. Tamoxifen's versatility is reflected in its wide range of applications across various medical disciplines. Here are some of the primary purposes for which tamoxifen is commonly prescribed. Breast cancer treatment. Tamoxifen plays a crucial role in the management of breast cancer, particularly in hormone receptor-positive cases. It is utilized as an adjuvant therapy, meaning it is administered after primary treatment, such as surgery or radiation, to reduce the risk of cancer recurrence and improve overall survival rates. Fertility preservation. In certain cases, tamoxifen is employed as a fertility preservation strategy for women undergoing chemotherapy or other cancer treatments that may impact their ovarian function. By inhibiting estrogen receptors in the ovaries, tamoxifen can potentially protect these organs from the damaging effects of chemotherapy, thereby preserving fertility. Gynecomastia, male breast enlargement. Tamoxifen is sometimes prescribed to treat gynecomastia, a condition characterized by the abnormal development of breast tissue in males. By blocking estrogen receptors, tamoxifen can help reduce breast enlargement and alleviate associated symptoms. Bipolar disorder. Emerging research suggests that tamoxifen may have therapeutic benefits in the treatment of bipolar disorder, particularly in addressing manic episodes. However, further studies are needed to fully understand its efficacy and potential role in this area. Benefits of tamoxifen. Tamoxifen offers a range of benefits that contribute to its widespread use in various medical conditions. Some of the notable advantages include improved survival rates in breast cancer patients. Numerous clinical trials have demonstrated that tamoxifen can significantly improve survival rates and reduce the risk of recurrence in women with hormone receptor-positive breast cancer. Fertility preservation potential. By protecting ovarian function during chemotherapy, tamoxifen may increase the chances of preserving fertility in women undergoing cancer treatment, allowing them to consider future pregnancy options. Reduced risk of osteoporosis. Tamoxifen has been shown to have a protective effect on bone density, potentially reducing the risk of osteoporosis in postmenopausal women. Cost-effectiveness. Compared to some newer targeted therapies, tamoxifen is generally considered a cost-effective treatment option, making it accessible to a broader patient population. Potential side effects of tamoxifen. Like any medication, tamoxifen is associated with potential side effects that patients should be aware of. Some of the most commonly reported side effects include menopausal symptoms. Tamoxifen can induce or exacerbate menopausal symptoms such as hot flashes, vaginal dryness, and mood changes due to its anti-estrogen effects. Increased risk of blood clots. There is a slightly increased risk of developing blood clots, particularly in the legs, deep vein thrombosis, or lungs, pulmonary embolism, in patients taking tamoxifen. Endometrial cancer risk. Long-term use of tamoxifen has been associated with a slightly increased risk of developing endometrial cancer, cancer of the uterine lining. Cataract formation. Some studies have suggested a potential link between tamoxifen use and an increased risk of developing cataracts, although the evidence is not conclusive. Bone loss. While tamoxifen can help maintain bone density in postmenopausal women, it may contribute to bone loss in premenopausal women, potentially increasing the risk of osteoporosis. It is essential to discuss these potential side effects with a healthcare professional and weigh the risks against the potential benefits of tamoxifen treatment. Dosage guidelines for tamoxifen. The dosage of tamoxifen is typically determined by the specific condition being treated and the patient's individual factors, such as age, overall health, and response to the medication. Here are some general dosage guidelines. Breast cancer treatment. The standard dosage for adjuvant breast cancer treatment is 20 mg once daily, taken orally. Treatment duration may range from 5 to 10 years, depending on the individual case and risk factors. Fertility preservation. The recommended dosage for fertility preservation during chemotherapy is typically 20 mg once daily, initiated before or during the chemotherapy regimen. Gynecomastia. The typical dosage for the treatment of gynecomastia ranges from 10 mg to 20 mg once daily, taken orally. Bipolar disorder. Dosages for the treatment of bipolar disorder are still being investigated, but initial studies have explored dosages ranging from 20 mg to 80 mg per day. It is crucial to follow the dosage instructions provided by a healthcare professional and not to adjust or discontinue the medication without proper medical supervision. Risks associated with tamoxifen. While tamoxifen offers significant benefits, it is essential to be aware of the potential risks associated with its use. Some of the key risks include increased risk of endometrial cancer. Long-term use of tamoxifen has been linked to a slightly increased risk of developing endometrial cancer, cancer of the uterine lining. Regular monitoring and prompt reporting of abnormal vaginal bleeding are recommended. Blood clot formation. Tamoxifen may increase the risk of developing blood clots, particularly in the legs, deep vein thrombosis, or lungs, pulmonary embolism. Patients with a history of blood clots or certain risk factors may require additional precautions. Cataract development. Some studies have suggested a potential association between tamoxifen use and an increased risk of developing cataracts, although the evidence is not conclusive. Bone loss. While tamoxifen can help maintain bone density in postmenopausal women, it may contribute to bone loss in premenopausal women, potentially increasing the risk of osteoporosis. Drug interactions. Tamoxifen can interact with certain medications, including some antidepressants, anticoagulants, and certain cancer treatments. It is crucial to inform healthcare providers about all medications being taken to avoid potential interactions. Patients should discuss these risks with their healthcare team and weigh the potential benefits against the risks based on their individual circumstances. Tamoxifen alternatives and considerations. While tamoxifen has proven to be an effective treatment option for various conditions, it is essential to explore alternative therapies or considerations based on individual patient needs and preferences. Some alternatives and considerations include aromatase inhibitors. For postmenopausal women with hormone receptor-positive breast cancer, aromatase inhibitors, such as anastrozole, letrozole, and exemestane, may be an alternative or complementary treatment option to tamoxifen. Targeted therapies. In certain cases, targeted therapies like trastuzumab, Herceptin, or pertuzumab, Perjeta, may be used in combination with or as an alternative to tamoxifen for the treatment of specific types of breast cancer. Ovarian suppression. For premenopausal women with hormone receptor-positive breast cancer, ovarian suppression, through medication or surgery, may be combined with tamoxifen or other therapies to reduce estrogen levels. Fertility preservation techniques. Alternative fertility preservation techniques, such as embryo or oocyte cryopreservation, may be considered for women who cannot or prefer not to use tamoxifen during chemotherapy. Lifestyle modifications. In some cases, lifestyle changes, such as maintaining a healthy weight, regular exercise, and a balanced diet, may be recommended to complement or potentially reduce the need for certain medications like tamoxifen. It is crucial to have open discussions with healthcare providers to explore all available options and make informed decisions based on individual circumstances and preferences. Tamoxifen in breast cancer treatment. Tamoxifen has played a pivotal role in the treatment of breast cancer, particularly in hormone receptor-positive cases. Its ability to block the effects of estrogen on breast cancer cells has made it a valuable adjuvant therapy, reducing the risk of recurrence and improving overall survival rates. In the context of breast cancer treatment, tamoxifen is typically prescribed as a daily oral medication for a duration of 5 to 10 years, depending on individual risk factors and response to treatment. It is often used in combination with other therapies, such as surgery, radiation, chemotherapy, or targeted therapies, as part of a comprehensive treatment plan. It is important to note that tamoxifen is primarily effective in treating hormone receptor-positive breast cancers, which are cancers that rely on estrogen for growth and proliferation. In cases of hormone receptor-negative breast cancers, alternative treatment approaches may be recommended. Regular follow-up and monitoring are essential during tamoxifen treatment to assess response, manage potential side effects, and make any necessary adjustments to the treatment plan. Tamoxifen and fertility preservation. For women undergoing cancer treatment, preserving fertility can be a significant concern. Chemotherapy and certain radiation therapies can potentially damage ovarian function, leading to infertility or premature menopause. Tamoxifen has emerged as a potential fertility preservation strategy in these situations. By inhibiting estrogen receptors in the ovaries, tamoxifen may help protect these organs from the damaging effects of chemotherapy. This protective mechanism can potentially preserve ovarian function and increase the chances of maintaining fertility after cancer treatment. Tamoxifen is typically administered before or during the chemotherapy regimen, with the recommended dosage being 20 mg once daily. However, it is important to note that tamoxifen does not guarantee fertility preservation, and its effectiveness may vary among individuals. In addition to tamoxifen, other fertility preservation techniques, such as embryo or oocyte cryopreservation, may be considered based on individual circumstances and preferences. It is crucial to discuss fertility preservation options with a healthcare team, including a reproductive endocrinologist, to explore the most suitable approach. Conclusion: the importance of consulting a healthcare professional. Tamoxifen is a versatile medication with a wide range of applications, from breast cancer treatment to fertility preservation. While it offers significant benefits, it is essential to be aware of the potential side effects, risks, and considerations associated with its use. It is crucial to consult with healthcare professionals, including oncologists, gynecologists, and pharmacists, to determine if tamoxifen is an appropriate treatment option based on individual circumstances. They can provide guidance on dosage, monitoring, and management of potential side effects, as well as explore alternative therapies or complementary approaches. Remember, every patient's situation is unique, and open communication with healthcare providers is key to making informed decisions and ensuring the safe and effective use of tamoxifen or any other medication. If you or a loved one are considering tamoxifen treatment, we encourage you to schedule a consultation with one of our experienced healthcare professionals. Our team of experts will provide personalized guidance, answer your questions, and help you navigate the best course of action for your specific needs. Don't hesitate to take the first step towards better understanding and managing your health. Contact us today to schedule your appointment.